Dentistry is unique in a certain way. During the pandemic, when a lot of people were losing their business, dentistry actually grew. We were very strong during the pandemic. I think it's the time afterwards that has been difficult.
It's been a tough year, this last year or two, driven mostly by pressures on cost. So wages are up significantly for most of the clinical and front office positions.
The challenge is in having a good team and really attracting good people to your practice and being able to keep them.
We're not in the Lay's potato chips, we'll make more when it comes to patient opportunities anymore. We have got to make sure that every call that comes in, every patient that walks in our door, we're making the most of that opportunity. And
the call is very strong now to change strategies.
Marketing has also become a huge focus. Also, it's not as simple as having a website and all the gadgets on your website. It's about reviews. It's getting out there with your feet on the ground. It's going out and doing things that we haven't done before, engaging, say, local media, engaging certain communities within our larger demographics.
So we've gone back to that old idea that you need to connect people to people before you can connect them to anything else. And we're learning so much about the marketplace. We're learning so much about our patients, and we're able to use AI in so many different ways to really bring in and evaluate that data.
AI is not something that is going to be a choice. It's coming, and it's coming in a big way. So it's a matter of understanding that this is something that's going to be implemented.
I think the challenge has become, how do we use it in a way where we can grow and benefit our practice, but not take away the components that our team members enjoy? Let them have the things that they love to do, the things that they're experts at, and use AI to complement them.
We have all of our offices on the Birdeye platform, and I'm not saying anything new here, but reviews are really driving new patients, or at least the perception of our offices and our teams. Having AI be able to do some nice generated responses that learn what our offices would say, our office managers would say, saves time.
We've been using Birdeye for so long. Our team has gotten so used to interacting with patients on a more personal level. And, that phone call becomes a text, and now we're responding to them. And it's that kind of constant interaction is so normal for them now that they're actually embracing this AI technology, and not one person has had any hesitation.
Using these tools to the next level, I think is going to strengthen relationships, make every marketing communication work better.
If you have tech, use it. Use it and talk about it. You want to be at the forefront. You don't want to play catch up. Talk about it, get your teams comfortable, and look at all aspects of the business.
We are in an era where, as people get older, patients are a little more apt to be loyal to a dental practice, loyal to their primary care provider, static in terms of how they use that. Younger generations are using urgent care for their primary care and episodic care for everything else. And so we've got to really adapt and make ourselves super easy to do business with, give them reasons to make more permanent relationships with their providers, and really just have our finger on the pulse of what the next generation of patients and employees are looking for.
It's really our responsibility to bring our teams into this next phase of dental. When you're talking about not only technology, but patient behavior.
I think that the best thing that we can do is make sure we're just staying a step ahead. And the one thing I can say with these people that are directly competing with each other is it's the people that embrace change the fastest, embrace change as quickly as we can, stay adaptable.